Hello, my name is Chad Trask, and I will be informing you about antisocial personality disorder. I chose this because my major is psychology, and I found this particular disorder to be very interesting. Throughout the presentation, will refer to the disorder as ASPD for short to make things easier. So, ASPD is usually misunderstood by most people for a few reasons. One of the things that people get confused about is that ASPD and being a psychopath are the same thing. However, they are not. Psychopathy is not even seen as a real disorder by the American Psychiatric Association, so they obviously can't be the same thing if one of them is not even real. Also, most people with this disorder are very, very hard to detect. They're compulsive liars and do many things just for the rush. This is why they're hard to detect, is because of all the lying. Their feelings are basically just shut off to others, and they only care about themselves. This is where a lot of manipulation comes in. And this is to help them get the things that they want, or to do the things that they want to do. And they'll use the relationships with friends, family, boyfriends, girlfriends, husbands, wives, sometimes just random people, and say they're in a relationship. They can be in a relationship for a long time, a couple years maybe. One day, when they feel like they've gotten all they wanted out of this person, they're done, they can just up and leave without any remorse for the other person. The other person can be crying and begging, and there will be no changing their mind, because it's just for them. There's also a sense of fearlessness and lots of non-normal behaviors that occur, and some of this is law-breaking, because laws just basically don't compute in their heads, and therefore lots of people with ASPD get in trouble with the law and also with drug abuse and alcohol abuse. This is because they feel like none of these things will have adverse effects because they're just doing what they want to do. They're just getting what they want to get. And so most often, this is why these things occur, but they don't always occur with people with ASPD, but most often they will happen. As far as where it comes from, there's a few theories. Some evidence has shown that it can be genetic, but it does not always have to be. The biggest contributor seems to be how someone is raised. Neglect or even being an overbearing parent can both lead to ASPD in some instances. This is not the case in every child, obviously, that has been treated these ways, but there can be factors. Lots of people with ASPD can be shown to have come from an orphanage. This is most likely due to the lack of structure and attention each individual child gets when they're there. And also, a lack of structure in a normal family can also have adverse effects and lead to ASPD if the child just gets to do what they want to do all the time and there's no structure, there's no rules, then this can promote the disorder. As I said earlier, detection is very difficult, and some people can go their whole lives with ASPD and never be found out. Unless they're getting in trouble with the law or drug abuse, or somebody just happens to know what somebody with ASPD acts like and they just can figure it out, then those are the only cases where they will be found out. Other than that, there's no reason why somebody with ASPD would be found out, because most often they just seem like a normal person. You could walk by somebody with ASPD every single day and you would not even realize it. Treatment has shown to be almost completely ineffective unless treatments and therapies are started when someone is very young. And this is seen as before 15. This is because somebody cannot actually develop ASPD before the age of 15. They can show signs of developing it, but it will not fully be there until 15. And if a child is thought to have ASPD, then treatment needs to start immediately. And things to be looking for is how aggressive is the child? Are they getting in lots of fights with other kids? And also, do they share, or are they just taking? And how do they play with other kids? Are they playing fair? This sounds like lots of kids, obviously, but these instances would be much, much more severe than the ones that you would just think in everyday life. There have been a few cases of people shown getting better from ASPD, and these cases are usually later in life. But this is thought to be them just lying and pretending to be better so that they can get out of treatment and just continue on with their life because it just seems to be getting in their way. There was this one instance I read about where this girl was going to therapy with her parents, and they had been going for a while now, and Finally, she broke down. She cried. She apologized to everyone for everything she had done. Her parents started crying with her. They were super happy, but the therapist was not buying it. And the parents got upset with the therapist because they thought she was cured finally, and the therapist would just not buy into it. And so they were fighting for a while, and then the girl, after a certain amount of time, I guess, she just stopped crying all of a sudden, and everyone looked kind of astonished. And she looks up at the therapist, and she's like, "Wow, you're good. I could not trick you." And everyone realized at that moment she had been lying. She had been crying and apologizing, but it was all just a ruse to get a rise out of everyone, and because that's what she wanted to do. And so people with ASPD can be very, very tricky. And that's the biggest reason why detection is so hard for people. And yeah, so that's just a quick overview of antisocial personality disorder and what it entails. Thank you for watching, and if you have any questions, leave them in the comments section, and I will try to answer them to the best of my abilities. Thank you.